Bismillah ar-Rahman ar-Rahim. My name is Dr. Ahmed Ismael, Assistant Professor of Neurology. Our topic is about Alzheimer's disease. We'll discuss the incidence of Alzheimer's disease, the risk factors of Alzheimer's disease, the clinical picture and the manifestations of Alzheimer's disease, the neuropathology of Alzheimer's disease, the required investigations for the diagnosis of Alzheimer's disease, and lastly we'll discuss the management and the treatment of Alzheimer's disease. Alzheimer's disease is the most common degenerative dementia. It represents about 60% of all types of dementia. Risk factors of Alzheimer. Number 1, age. It is common in old age, and the prevalence increases from about 3% in people over 65 years to 47% in those older than 85 years. 6. Females have higher incidence than males. Education. The disease is more common among persons who are low educated and has less cognitive occupations. Genetic and family history. In about 2 up to 5% of cases. First degree relatives have high risk of dementia development, and it is transmitted in an autosomal dominant fashion. Clinical pictures of Alzheimer's disease. Early stage. This is a mild stage, and the duration period is 2 up to 4 years. There is a frequent recent memory loss, particularly for recent conversations and events. Repeated questions. There is some problems expressing and understanding language. Writing and using objects become more difficult. Depression and apathy can occur. Personality changes may accompany function decline. Need reminders for daily activities and difficulties with sequencing, which impact driving early in this stage. Second stage, considered as mild or moderate stage, and the duration is from 2 years up to 10 years. Patient can no longer cover up problems. There is a persistent memory loss which impacts life across setting. Rambling speech, unusual reasoning, confusion about current events, time and place. Patient may become lost in familiar settings. There is sleep disturbances, mood, and behavioral symptoms. About 80% of patients showed emotional and behavioral problems. Slowness, rigidity, tremors, and gait impairment can occur, which impact mobility and the coordination. Patients need structure, reminders, and assistance with activities of daily living. The third stage is moderate stage. There is increased memory loss and confusion. There is a problems of recognizing family and friends, inability to learn new things. There is a difficulty carrying out tasks that involve multiple steps, such as getting dressed. There is a problems coping with new situations. Also, patients show delusions and paranoia and impulsive behavior. In this stage, there is a damage in areas of the brain that control language, reasoning, sensory processing, and conscious thought. The last stage is considered as the severe stage, and the duration is 1 year up to 3 years. The patient becomes confused about past and the present. There is loss of recognition of familiar people and places. The patient becomes generally incapacitated with severe to total loss of verbal skills. The patient becomes unable to care for self. There is frequent falling and immobility become more like. There is a problems with swallowing. There is incontinence and severe illness. Also, patients showed severe mood disturbances, behavioral problems, hallucination, and delirium. Lastly, the patient need total support and care, and often die from infections or pneumonia. Pathology of Alzheimer's disease. Alzheimer's disease is characterized by loss of neurons and synapses in the cerebral cortex and certain subcortical areas. This loss results in gross atrophy of the affected regions, including the temporal lobe, parietal lobe, and parts of the frontal cortex and cingulate gyres. Both amyloid plaques and neurofibrillary tangles are clearly visible by microscopy in the brain of Alzheimer's disease patient. Plaques are dense, mostly insoluble deposits of amyloid beta peptide and cellular material outside and around neurons. while tangles, which is neurofibrillary, are aggregates of the microtubule associated protein tau, which has become hyperphosphorylated and accumulate inside the cell themselves. Although many older individuals develop some plaques and tangles as a consequence of normal aging, the brain of Alzheimer's disease patients have a greater number of them in specific brain regions such as the temporal lobe. This means both plaques and tangles may occur with normal aging, while in Alzheimer's disease it occurs in much more affection in Alzheimer's disease. This cross section of the brain, this is the normal brain, this is the gyrus, and this is the sulcus. We notice here the thickness of the cerebral cortex in normal patient is more than the thickness of the cerebral cortex in Alzheimer's patient. Also, the sulci here is normal, but in Alzheimer's patient it is more wide. There is a cross section here affecting the language and memory area with normal patient, and compared with Alzheimer's patient we notice that the sulci is more wide and the thickness of the cerebral cortex is less in Alzheimer's patient, and the total volume of the brain is atrophied, and the ventricles here is more dilated compared with the size of the ventricle of the normal brain. This is also another cross section of normal brain section here compared with the cross section of the brain in Alzheimer's patient. We notice here the size of the gyri thickness here is more in normal patient compared with the Alzheimer's patient where there is decreased thickness of cerebral cortex, and also widening of the sulci compared with normal brain tissue. We will talk about the amyloid plaques and the neurofibrillary tangles. First, the amyloid plaques are made up of small peptides of about 39 up to 43 amino acids in length, named beta amyloid. Beta amyloid is a fragment from a larger protein named amyloid precursor protein. This is beta amyloid, which is a part of the amyloid precursor protein. In Alzheimer's disease, there is abnormal cleavage of the amyloid precursor protein by certain enzymatic activity and the cleavage of beta amyloid fragments, and the accumulation of these fragments forming beta amyloid plaques. Beta amyloid plaques accumulate outside the neurons. So this gives rise to beta amyloid, which form clumps that deposit outside the neurons in dense formation known as senile plaques. This senile plaques will interfere with the normal interaction and communication of the normal brain cells, which is present outside the neurons. Also, in Alzheimer's disease, there is what is named a tauopathy, which is due to abnormal aggregation of tau protein. Every neuron has a normal cytoskeleton, which is forming internal support for the neuron by a structure named microtubules. These microtubules act like tracks, guiding nutrients and molecules from the body of the cell to the ends of the axons and the back. There is a protein named tau stabilizes the microtubules when phosphorylated, and therefore named microtubule associated protein. This occurs normally, but in Alzheimer's disease, tau undergoes chemical changes and become hyperphosphorylated. It then begins to pair with other threads, creating neurofibrillary tangles and cause disintegration of the neuron transport system. This figure showing the neuron cells and their axons. There is an accumulation of amyloid plaque outside the cells here and here and here, while the neurofibrils, which is normal here, this figure, while in Alzheimer's disease there is abnormal hyperphosphorylation of tau protein, causing disintegration of this neurofibrils and causing to formation of neurofibrillary tangles, which is formed inside the cell. This other diagram showing the normal neuron in normal patient, normal individuals, while in Alzheimer's disease there is abnormal formation of intracellular neurofibrillary tangles and extracellular amyloid plaques. The extracellular amyloid plaque will interfere with the normal communication between the neurons, while the tangles, which is intracellular, will impair the function of the neuron itself, causing the Alzheimer's disease. Another diagram showing the healthy brain, the mild Alzheimer's disease, and severe Alzheimer's disease. In the healthy brain, there is normal thickness of the cerebral cortex, while the mild disease there is decreased thickness of